Good evening. My name is Mario Marroquin, and I am the nurse who will be taking care of you today. And I will be doing an evaluation, evaluation on your head, ears, nose, throat, and neck. Just for safety, can I have your initials and your date of birth, please?
EO 83167.
Excellent, that matches my records exactly. So, again, welcome. Thank you for coming in. And I'm going to be washing my hands. Okay, and I'll be using some latex gloves to examine you. Do you have any allergies to latex or anything like that?
No.
Okay, really good. Thank you. All right, so could you please tell me the purpose of your visit with us today?
I'm just here for my routine checkup.
Okay, really good. Okay, so once again, I will be checking out I'll be examining your head, ear, nose, and throat. Is there any information, any abnormalities that you would like to let me know before we start examination?
No, other than I have had a slight sore throat and a dry cough for about 2 days.
Okay,
I wear reading glasses.
Excellent. Okay.
And I've had some dental work done.
Okay.
Oh, I also had some cosmetic surgery on my nose, so I have a slight indentation.
Okay, not a problem. So again, you've had a sore throat and a little coughing for 2 days now.
Yes.
Gradual onset, sudden onset.
Very sudden,
Okay.
but not very uncomfortable. It's just very slight.
Okay. So we're going to start off with your inspection. Again, we start off with the head, ears, nose, and throat. So I'm going to be looking. If you please remove your glasses for me, that's where I was going with that. So thank you so much. So first thing we do is our inspection. So I'll be inspecting your head and your hair first. So again, the first thing we do is we inspect for symmetry, and everything looks very symmetrical. Visually, really good. Your hair is mid back length. Dark brown in color. Do you color your hair, ma'am, by some chance?
No.
Okay, really good. Alrighty, so the inspection looks good. Your hair does look very shiny, looks clean, very well groomed. So I will be moving on from inspection now to palpation. What I'm going to do is be palpating your skull, your scalp, and looking at your scalp, okay? Here we go. Okay, first thing we do is here. And you do see your scalp, white in color, very clean, very good. Okay, good. No dandruff noted. Really good. Alrighty, as we do that, I'm going to be palpating your scalp, your cranium here. Any pain anywhere where I'm palpating?
No.
Okay, really good. All right, well, thank you so much for that, okay? So we're going to move on from your head now to your ears, nose, throat, and neck, okay? So again, would you do me a favor and pull your hair back behind your ears, okay? Really good. So we're going to start with the inspection of these areas first, okay? Really good. So your ears, they are symmetrical bilaterally. Really good, okay? Really good. Now we're going to go down from your ears, your nose. Again, you did report a surgery that you had. Really good. Although you do have the surgery there, your nose is midline. Okay. And I noticed when you smiled, you have a very symmetrical smile. White teeth, very nice. Good. Thank you. Your eyes are also symmetrical, blue. Really nice. Okay, good. And I know a very good distribution of hair throughout your eyebrows and your eyelashes. Really good. Okay, good. And I'll be looking now down to your neck for inspection. Your trachea looks midline. Neck is symmetrical. Really good. Would you do me a favor, please? Would you go ahead and turn all the way to your right? Okay, to your left. Okay, straight up. And touch your chin to your chest. Really good. Any pain or comfort during your range of motion? Okay, really good. Alrighty. Okay, so I'm going to go ahead and move now to the inspection of your eyes, nose, and throat with the light, okay? Okay. So what we'll do now, I'll go ahead and start off with your ears, okay? Okay, thank you. Might be a little uncomfortable, please excuse me. Really good. Okay, really good. Apologize. Okay, from your ears, and I'm gonna go ahead and now move to your eyes. Would you please look forward? I'm gonna shine the light in your eye, each one individually, and look for the reaction of your pupil. Good. Good. All right. Will you tilt your head up a little bit, please? I'll be looking in your nose now. Good. Good. And although you did have surgery, I did not see any deviation to your septum. It is midline. Will you do me a favor? Will you cover your right nostril and exhale? Okay, and on your other. Okay. Did you have the same flow
It's
back?
pretty much the same.
Okay. Really good. Okay, so now that I have the light right here, I'm going to be getting a tongue depressor. Do you have any issues with a tongue depressor?
No.
Okay, really good. So I'll be inspecting your mouth and dentistry right now. Okay, will you please open your mouth? Stick out your tongue, please. Say ah. Really good. Okay. Really good. Very good. So yes, you've had some dental work. Very good dental work, by the way. So good. Okay. All right. Okay, so now I'm going to be moving on to your neck. We start even with your the palpation of your lymph nodes. So we're going to start with your periauricular nodules, which are in front and behind your ear. Move my way down to the back of your neck and underneath your chin. Okay? So here we go. Okay, so the first thing we're going to do is start going right here. The periauricular nodules. Okay. Any pain or discomfort?
No.
Okay. Any pain or discomfort?
Mm-mm.
Okay, we push your head down. There you go. Okay. Any pain or discomfort while we did this?
No.
Okay. So what we're doing while I'm palpating your neck, I'm going to go ahead and back up to your sinuses. With your cough and with your cough that you've had sore throat in a day, throughout these days, I want to make sure that your sinuses are clear, okay? So I'll be doing a couple things. First of all, I'll be palpating your sinuses. We have them in the frontal and your maxillary, okay? After that, I will be shining the light and illuminating your sinus cavities to make sure that they are clear, okay? Will be good. So we start first with palpation, okay? Any pain to palpation under your eyes, really good. And any pain right here through the frontal area?
No.
Okay, really good. And as I said, we'll be illuminating the sinus cavities. Excuse me. Okay. Good red illumination throughout your forehead. Very good. Thank you so much. Okay, really good. So now I'll be moving on to your cervical spine, okay, and to your neck. So a couple things we're gonna do with your neck. First, I'm gonna be palpating your neck for the different structures and going one by one, okay? So first, your trachea is midline. Thank you so much for your. So trachea, midline, neck is symmetric. I do see your carotid pulsations through your neck right here. I can also palpate. Present, okay? I'm going to be palpating your thyroid, okay? I'm going to be pushing to one side, I'm palpating the opposite side. Good, can you please swallow for me? Okay, opposite side, pushing on one side, palpating on the other. Can you swallow for me, please? Really good, thank you, thank you. Any pain, discomfort during the palpation? Okay, and we do have also some lymph nodes in the front part of your chest above your supraclavicular line. Okay, so here we go. I'll be really good. No nodules. Note any pain or discomfort when we do this? Okay, really good. So last thing we'll be doing is inspecting your cervical spine. Thank you so much. And I'm looking for symmetry of your neck. Okay, spine midline. I will be palpating up your cervical spine, and please let me know if there's any pain or discomfort as we go.
No pain.
No pain. Okay. Really good. Okay, well, thank you so much. I appreciate your cooperation. Do you have any questions regarding our examination for today that I can answer for you?
No, I don't think I have any questions.
Okay, well, thank you so much. I really appreciate your time, and it was a pleasure helping you.
Thank you.
Have a good